Over the past few years, we've established a comprehensive ecosystem of treatment modalities, if you will, where we provide personalized care to give our patients the relief that they need to get their lives back. Our expertise and experience allow us to tailor treatment plans to the specific needs of each patient. And today, we provide our pain care services through a growing network of clinics in 4 provinces. And I mentioned earlier that we also operate the largest medical cannabis telehealth network in the country.
My next guest is Wayne Cockburn. He's the president of Pathway Health Corp, trades on the TSX Venture under the symbol PHC. Wayne, welcome.
Thanks very much, James. Really appreciate the opportunity to speak with you and your listeners today.
Great to have you as well. Wayne, let's start with an overview. What is the business of Pathway Health Corp?
Well, Pathway Health is one of the largest providers of chronic pain services in Canada. We offer a wide range of interdisciplinary services to our patients, including some pretty leading edge treatments that are only available in a handful of clinics in Canada. We own the largest out-of-hospital pain clinic in Canada, which is located in Toronto. And we also operate the largest medical cannabis telehealth network in the country. Our company was created several years ago with a clear mission, and that's to make a difference for chronic pain sufferers who need more than what's available today, rather. So the statistics on chronic pain often surprise people, but 1 in 5 Canadians currently suffers from it. And thousands are dying each year from opioid addiction. So it's pretty clear that the traditional methods of treatment have really proven to be insufficient. And it's also very expensive. The direct and indirect costs associated with chronic pain are more than $50 billion each year, which is more than cancer, diabetes, and heart disease combined. And there's a real shortage of chronic pain doctors in Canada. And as a result, the wait list to see a specialist can range anywhere from 1 to 3 years, depending on what part of the country you're in. So over the past few years, we've established a comprehensive ecosystem of treatment modalities, if you will, where we provide personalized care to give our patients the relief that they need to get their lives back. Our expertise and experience allow us to tailor treatment plans to the specific needs of each patient. And today, we provide our pain care services through a growing network of clinics in 4 provinces. And I mentioned earlier that we also operate the largest medical cannabis telehealth network in the country.
Sure.
But we're also working very closely with some of the largest retail pharmacy companies in the country, where we deliver cannabis education programs to their pharmacists, and where we've built a platform for pharmacist referrals for chronic pain.
Okay. So you are basically pain management using cannabinoids.
Cannabinoids is just one service that we provide. So, for example, in our Toronto-based clinic, we do everything except medical cannabis. I once saw a list of the services that we provide here, and it's somewhere between 40 and 50 different services.
Cannabis, and so when you say different modalities of pain management, does that mean sort of like you graduate through different therapies?
Each patient is different. Again, I mentioned that we tailor design specific programs for each patient, and you may have 2 patients present themselves with the same pain in the same location, and with one patient, one modality may work, and with the other patient it may not. So it's in some cases it's a trial and error until they find something that actually works for the patient.
Interesting. So I see that you've also got, it mentions ketamine infusions on your website.
Yes. So again, ketamine, when we provide these ketamine infusions at our main clinic in Toronto, because it requires this is obviously something that you can't do through telemedicine. It requires a physician oversight, and a nurse will be on standby to they actually sit by the patient as they undergo the treatment, just to make sure that everything's okay. But we are looking to expand the ketamine services in some of our other clinics across Canada.
Mm-hmm. That's very interesting. So how many patients do you have now, and are they, it sounds like they must be almost an entirely recurring audience.
Yeah, unfortunately they are. We see in our Toronto-based clinics about 10,000 patients each year. On the medical cannabis side, again, which is virtual health, we have between 50 and 60,000 active patients at any one time. Collectively, since the beginning of the company, we've seen probably 300,000 patients.
Oh, wow. That's a lot. Okay.
Yeah, it's a lot.
So then you've, tell me about your financial picture. What's the business sort of generating in terms of cash flow, and is it profitable?
Well, on the income side, we've been aggressively rolling up the pain clinic industry over the past 3 years, and this is actually reflected in our revenue growth. So 3 years ago, we did about 600,000 in revenue, and last year we did about 12.5 million. And since going public about a month ago, we haven't made any changes to our approach at building the business. We're continuing to roll up the chronic pain business. We are not yet profitable, but we're very close to being profitable.
Wow, on substantial revenue too. Well, that's great. What is the most lucrative part of the business? What is the pain sort of treatment that most of your patients are gravitating towards?
We do some private medicine, and this is on some of the more the newer technologies, if you will. We get a lot of American citizens coming up to have some of these treatments, and the margins on those are fairly good. For OHIP covered, for government covered services, the margins tend to be fairly slim.
Mm-hmm.
And so it's on more of the, I want to use the word eclectic, but more of the advanced technological treatments. That's where the better margins typically occur.
Very interesting. What kind of competition is there out there? I mean, it sounds like you could be competing with every doctor and hospital and clinic in the country.
Well, surprisingly, that's just not the case, which is one of the reasons why the wait list can be anywhere from 1 to 3 years. The industry itself is actually quite fragmented. There's a lot of smaller places. In fact, if you walk down Main Street of any town or any city, you'll see a chiropractor, as an example, saying that they do pain management. That may in fact be the case, that they do treat patients with pain, whether it's acute or chronic. But in terms of actual sizable players, there's only a handful. You could probably count them on one hand in the country. And we're probably number 2 at this point.
Wow. Interesting. Okay, so then what's the next 6, 12, 18, 24 months look like in terms of growth for you? What's the strategy to grow the business?
Well, there's really 2 initiatives underway. The first is we're going to continue to aggregate, bring on new patients through acquisition. As I said, we've gone from 600,000 to 12.5 million in 3 years. We're in discussions with a number of potential acquisition targets, so we're going to continue. The idea being that we now have fixed expenses primarily in the business, and that as you start to add on more revenue, they become accretive acquisitions. So that's one area. But probably the biggest area for us in terms of growth is our relationship with the pharmacy companies. We've just recently signed a couple of important agreements with 2 of the largest pharmacy companies in Canada. In June, we signed a collaboration agreement with PharmaChoice Canada, and this is regarding the implementation rather of our medical cannabis management system, or what we call our MCMS, in more than 900 independent pharmacies across Canada. And just earlier this month, we signed a similar agreement with Sobeys. The idea being is that there's essentially 3 levels of of agreements that we're working on with the pharmacies. And I just take a couple of minutes to explain, because this really is where the growth potential occurs.
Okay.
The first area of the agreement is that we offer up an accredited training program for pharmacists. The Cannabis Act was passed back in 2018, where they deschedulized cannabis and made it a legal drug. They are currently, the government is currently reevaluating the Cannabis Act, and it's expected sometime probably later this year that additional changes are going to be made to the act, where they're going to be separating, to really oversimplify it, THC, which is the psychoactive component of of cannabis rather,
Yep.
and CBD, cannabidiol, into a separate, because right now CBD is governed exactly the same way. It's regulated exactly the same way as THC. Even in spite of the fact that it's non-psychoactive, but it does appear to have provide a lot of benefits to a lot of people in terms of a couple of examples: reduced anxiety, better sleep, and pain management. And so the belief is that they're going to be separating the two and then moving CBD more and treating it more like a natural health product. A cannabis health product is what they're going to be calling it. And that there's probably going to be still some control, some restrictions on how it's regulated, how it's sold. And from everything that we hear, it's likely to be through the pharmacies. The pharmacies have been lobbying very hard to become the sole source of CBD sales. And so we've been actually working on this for 2 years now. This is a change that we've been anticipating. And so we have developed this cannabis training course for pharmacists, because as it turns out, according to Stats Canada, 1 in 5 people over the age of 15 has used cannabis in the last 3 months, which means that 1 out of 5 people that show up at the back counter of the pharmacies is using cannabis. And right now, the pharmacists don't feel adequately trained to be able to talk to them about it. And given that it's an approved drug, the pharmacists rightfully believe that they should have that open dialogue with their patients, but they really don't have the training. So we've got an accredited course for that. So that's the first part. The second part is developing a, I don't want to use the referral program, but that's essentially really what it is. The patient will go to the back counter and ask the pharmacist about medical cannabis. The pharmacist through our program will be trained on doing an initial assessment. It might take 5 minutes or so. And if it's deemed that that patient would be a good candidate for medical cannabis, they'll then be passed along to Pathway, where our physicians or nurse practitioners will get involved and we'll take over from there. So those are the two essential pieces of the agreements that we're signing now with the pharmacy companies. But it's the third piece, when back to your original question, where we see the growth occurring, it's the third piece that we see as probably the greatest single area of growth for Pathway Health. And that's in terms of working with the pharmacy companies to help them develop not just a brand strategy for this, what is essentially a brand new consumer packaged goods category. I mean, the pharmacies are already dedicating shelf space for this, even though there's been no formal announcement.
Yep.
So we are the experts in medical cannabis in the country. We're the largest. And we're medically and scientifically based. And so that gives us the chops, if you will, to be able to work with the pharmacies, the credibility to work with them, to not only help them develop the brand strategy, but also to help them develop and maintain, if you will, the product line for the products that the pharmacies will sell to their patients. And if we're strategic on this and we're successful in this, that means that Pathway could receive revenue for every CBD product that's sold.
Wow.
And it's estimated that within the next couple of years, that the CBD market in Canada alone could be worth about $2.5 billion. So it's a very important initiative for us.
Yeah. Okay. Well, Wayne, that's a great introduction to the company. We're going to follow the story with great interest. I appreciate your time today. I look forward to having you back soon. Thanks for your time today.
Thanks very much, James. I appreciate it.
You bet. Bye for now.